Part of efforts towards reducing the rate of maternal mortality rate in Nigeria, the federal government, in conjunction with the United States Agency for International Development, has flagged off the enrollment of pregnant women for health insurance scheme. The enrollment of 100,000 beneficiaries started in 2009 to improve the health care of residents of the Federal Capital Territory. As of today, about 160,000 beneficiaries have been enrolled from both the formal and informal sectors. Correspondent Kunle Ojo reports that the Usaid for the Federal Capital Territory, Francis Lois Adewumi, lauded the initiative of the federal government in this direction, noting that this informed the support and collaboration from the United States Agency for International Development. She declared that the agency would continue to support the effort of government in making sure that pregnant women and children enjoyed best of health services. The Minister of State for FCT, Dr. Maria, represented by her Chief of Staff at the event, said the federal government has put in place appropriate measures to guarantee the health care need of pregnant women, children and other vulnerable Nigerians, just as she enjoyed people to see the initiative as an avenue to improve their health.
I've been supporting FCT for the past 4 years in the areas of health system strengthening as well as improving outcomes for women and children. And I remember that during the first meeting we had with the Honorable Mandate Secretary, one of the things she said that she holds dear to her heart, that is one of our KPIs, is ensuring that the vulnerable, particularly pregnant women and children in the FCT, have health insurance.
The health insurance scheme is a renewed hope initiative, and over this renewed hope initiative, we have decided that no pregnant woman, we have zero tolerance for a pregnant woman to die because of delivery in Abuja.
In his remarks, the Chief Executive Officer of FCT Health Insurance Scheme, Ahmed Dan Fulani, said over 30,000 beneficiaries have been enrolled into the scheme, noting that emphasis have been on enrollment into the scheme and adoption of some beneficiaries.
We have enrolled through the National Health Insurance Authority more than 30,000 poor and vulnerable onto the Basic Care Provision Fund. In the next few weeks, we are going to add additional 30,000 poor and vulnerable onto this scheme.
High point of the event was the distribution of free kits to pregnant women that had been captured for the scheme.
With support from the FCT leadership, the Minister of State for Health, our Mandate Secretary and other Mandate Secretary here present, and our development partner, Usaid, through the IHP program,